Hey, did you guys see that new paper that came out just recently?
Yeah, the
Yeah,
the one for fear and anxiety.
yeah. Um, God, I don't know. I'm sure it's an isolate, and
Trina,
so,
everyone else is listening.
That's
okay.
okay. It's a good
That's
paper. Well,
okay.
it's an interesting paper.
It's an
Yeah,
interesting
no,
paper.
it's an interesting paper. I just think it's tough because how do we actually say, like, it's so hard to evaluate anxiety, right? Because I
So
think it's
subjective.
displayed so different in, I mean, Kathy, like it's displayed so differently in different animals. And so I think it's tough. Also, I think it has to be a fairly robust formula, right? Like I'm just worried you'd
Yeah.
have to use
Yeah.
such high doses of an isolate that it just wouldn't do the trick.
And
But
there
I
were
don't
no PK aspects to it either, right? So we don't.
know. And we
That's the
didn't
hard
test
one,
the
yeah.
metabolite either, right? So they were talking about looking at a metabolite of trazodone, right? And they didn't test the metabolite of the trazodone either. So I don't know. I think it's all really interesting. I mean, it's good just to get research out there. The more that's out there, the more we learn.
But it's not all that we can interpret it meaningfulness, right? Like, but we'll learn from each paper that comes out what we need to do better for the next one, I find.
But not to take what it says and say CBD couldn't work for anxiety, because I think
Exactly.
that's the correct
We
conclusion.
don't even know if there was any CBD in the bloodstream because they didn't test it and it was on a treat, right? We haven't really looked at the pharmacokinetics and bioavailability of having it in the treat,
Yeah.
which makes it hard.
Yeah.
Oh, we have to do housekeeping now.
Okay, here we go.
Yes. Okay. Fun stuff. Okay, so thank you everyone for joining this presentation, a series of case discussions. We'll begin in 1 minute. Before we start, I do have some housekeeping notes. First off, I want everyone to find their chat box. This is where you will type to me, the session moderator. Please use this for any tech support issues. We will use the Q&A box for a questions period at the end of the webinar. There are questions for our speaker. This can be found at the bottom middle of your screen. You should see an icon that says Q&A. Once you click that, your Q&A box will appear to the right. Please don't use the Q&A box for technical issues you might have. The chat and the Q&A are separate. Okay, and we're ready to begin.
Fantastic. Welcome, everybody. I'm Dr. Sarah Silcox. I'm the president of the Canadian Association of Veterinary Cannabinoid Medicine, and it is my absolute pleasure to welcome our panelists this afternoon to wind up our series on cannabinoid lectures by doing case discussions. And if you logged on a little bit early, you probably heard us doing what we do, and that is talking about papers and cases, because when you get us together, it's kind of hard to stop us from doing that. So we hope you'll enjoy some of these discussions as much as I know I'm going to enjoy hearing them as well. Our panelists include Dr. Trina Haza, who's an integrative veterinary oncologist based all the way out in Los Angeles. Thank you so much for joining us. Dr. Haza also serves as a consultant, one of the specialist consultants with veterinary cannabis education and consulting out of Colorado. And she is the founder and co-president of the Veterinary Cannabis Society out of the US. So we are very honored to have you with us today, Trina. I know your passion matches all of ours, if not exceeds it, so that's great. We also have Dr. Kathy Kramer. She's an integrative veterinary practitioner out of Vancouver, BC. She is a leader in veterinary cannabis use and education, and we are proud to have her as a director of the CAVCM. And finally, we have Dr. Connie Mosley, a veterinary anesthesiologist who operates an integrative pain management clinic out of VCA 404 Referral Hospital in Aurora, Ontario. She is also a founding director and the current vice president of the Canadian Association of Veterinary Cannabinoid Medicine. And so I'd like to welcome all of you. I'm going to turn it over to you guys so you can start talking about some of your cases.
Awesome. Well, thank you, Sarah. I really appreciate the introduction. I'm going to start off, I'm going to actually share my screen so I can review some of the cases that I've had. And these are some of my kind of really cases that are near and dear to my heart. So can everyone see okay? Can you guys see? Okay. So the first one is actually my own cat named Mr. Bean. He was a 10-year-old male neuter domestic short-haired cat that, as most veterinarians, we may see something and we're like, oh, we'll get to it later, right? So he was having, like, I thought maybe he was having, breathing a little bit heavier, having a little bit more, some obvious tachypnea. And I thought, let's just give it a time. Maybe it's his heart. He was born with a mucopolysaccharide storage disease, so had several different kind of congenital deformities and so forth. So anyway, I brought him in to the hospital finally, as we take our time doing this stuff as veterinarians. And I took radiographs, and as you can see, there was clearly a mass taking up, 90% of his thorax. So cytology indicated either a thymoma or a lymphoma. And he was a guy that I was told when I first adopted him in Connecticut, he was going to live for 6 months, and he had been with me for almost 10 years. So I thought, he hates coming to the hospital. I'm not going to bring him in. So I decided I was going to start him on cannabis. I started steroids, by the way, first. It didn't work. It almost made things worse because of his urinary incontinence and so forth. It made things worse. So I ended up just switching him to a cannabis product. Started at an 11-to-1 CBD to THC formula with about 0.2 or 0.28 milligrams of THC and 3 milligrams of CBD once daily. And then I started to titrate it up. So over several months, I went to BID dosing. I started to increase the amount of THC. And within 1 month of treatment, his coughing completely resolved. And he was going up and down the stairs. He had barely been able to move. He was basically lateral recumbent before. After about 4 months, he was receiving a 1.5-to-1, so almost a 1-to-1 formula. And look what happened. The THC went up from 0.28 to 3.4. So in this cat was about 2 kilograms. So it over 1 mg per kg of a 1-to-1. It was also, this particular formula was created at a company that does custom products. So we were able to increase the THC and increase the alpha pinene, which is a terpene that can help with bronchodilation. THC has also been shown to be helpful for bronchodilation. I use CBD to help with anti-inflammatory as well. And so we essentially put together a specific formula for him that was bronchodilatory as well as anti-inflammatory as kind of the main focus. He also was really picky with his eating. And so probably after a week of starting him on it, he had like the serious munchies. Like he ate everything. He was getting into the dog's bowl. It was nuts, but he had never seen him as happy. And I thought to myself, I should have absolutely put him on this and not waited until he was sick, right? He could have helped with his arthritis and so forth. After about 6 months of therapy, he ended up going blind. Just one day he went blind. And after I had the ophthalmologist take a look, they said that they think it was related to his mucopolysaccharide storage disease. He still had no clinical signs that was associated with his cancer. So here was him like lateral recumbent. He looks like he's sleeping. He was really tachypnic. And then post-treatment, he is hanging with his brother and doing really, really, really well. So do you want me to push pause here so we can do questions? Or you guys want me to go through all my cases? Sarah? Oh.
Sorry, I'd say keep going, finish your cases, and then if we've got questions that have come in about your cases specifically, we can go through those. Otherwise, we'll just move on to the next set of presentations, and we'll tackle questions as they come through at the end of each presentation.
Perfect, thank you. So this is a Hammer, who was a 12-year-old male neuter Jack Russell, who unfortunately was diagnosed with oral squame, indolent lymphoma, and bladder TCC, all at the same time, this poor dog. So he came to me, they wanted to debulk the squame in the mouth and the TCC, and for the lymphoma, we just actually said, let's just monitor it. It was an indolent form. And so they decided to start on palladium peroxicam. We got 6 months of control until progressive disease of the squamous cell and the TCC occurred. And the squamous cell progressed so much that it was actually causing facial deformity, and the dog was super painful opening its eye. And so they decided to start a 1-to-1 CBD to THC product. And look at this, this dog was receiving essentially 1 milligram of CBD and 1 milligram of THC, and the dog was 10 kilograms, okay? 3 months afterwards, the squamous cell carcinoma was 90% resolved. The TCC and lymphoma were stable, and the owner was psyched, right? The owner was so thankful this dog was doing as well. 2 months after that, the oral squamous cell carcinoma recurred. And the owners had reported they forgot to refill the medication. I mean, how do you, it's like so tough, right? Because you're like, something is working so well. And I know the pet was on nothing else, right? Like it wasn't on anything else. So I thought, geez. So they ended up forgetting to refill it. The tumor recurred. We ended up doubling the dose and there was still no response. He ended up getting some radiation and was euthanized 4 months after due to progressive disease. So here's his before picture. As you can see, he's got, you know, pretty severe facial deformity. He clearly is uncomfortable. And this was his after picture, where after, this was like 2 or 3 months after starting, the tumor was basically gone. I could hardly see it on physical exam. It was incredible. Last case is a dog named Baxter, a 9-year-old male neutered Cocker Spaniel that has a history of epistaxis, coughing, pretty severe anemia. He was diagnosed with a salivary gland carcinoma with metastasis to the regional lymph node in the lungs. The owners declined radiation and chemotherapy, but elected to pursue Palladia again, similar to Hammer, and prednisone, Chinese herbal medicine, and cannabis. So he was started right off the bat at almost a 1-to-1, a 1.5 to 1. And he started at 0.37 milligrams of THC, eventually transitioned to BID dosing, and they increased the dose over several months. Within, like I would say, within probably a month, the owner said the epistaxis had basically completely resolved, the coughing was gone. 6 months into therapy, the lymph node that was enlarged palpated totally normal, and at 9 months, the pulmonary mass resolved. After 1 year, I remember he came in and I could feel that lymph node start to come back. So we just upped his cannabis because we had kind of maintained it. And within 6 weeks, the lymph node was back to normal. I don't know if it was cancer in there or it was just inflammatory and it went away, right? I don't know, but it was pretty interesting, the timing of it. Again, I can't say. I remember when I FNA'd it, we didn't get back definitive cancer, but initially it was very difficult for them to get a diagnosis in the first place. So currently, as you can see, he went from a 0.37 milligram dose of THC up to 30 milligrams of THC twice a day. And he's only 18 kilograms, right? And he comes in for his rechecks and he looks like $1,000,000. Like he does not look high at all. His pupils are totally normal. He's not having urinary incontinence. I mean, none of the stuff that you typically see with THC toxicity we're noticing. We take his temperature when he's here. He's not hypothermic in any way. So just something interesting. Obviously, I think it took a long time to get the dog up to this dose, right? He ended up having to stop it due to something. Maybe there was a problem with the shipment. It was like a month off. He ended up stopping it, returning back. And I just had him started at just obviously a lower dose, like a quarter of what he had left off. And he was able to titrate back up within like 2 months. So it was pretty incredible. And here's the testimonial from the owner. This is how he looks. He looks great. He's happy and doing awesome. And then this was a 4th case I have, but I'll save this just in case we have time later. Those are the 3 I wanted to initially review. And then if we have time for an extra case, I'll do this one. So Kathy, I'll leave the next round to you.
Sure. Hey, I was going to ask, for your cat, did you go back and repeat the x-rays at all?
Everyone always asks that question, and I didn't, because I kept telling everyone, right? Like from a scientist, I was like, of course, I'm going to do it. I have to do it. I need to do it. And then like when I euthanized him, because he went blind very quickly, so I didn't do it before. And then the day I euthanized him, I was like, the scientist part of me just wasn't stronger than like the mother part. Like I couldn't, like I didn't need to take my cat who was dead and take radiographs. But man, it would have been so interesting to see, yeah. I think about it still clearly.
Interesting. All right, let me share here.
Maybe just while you're pulling your screen up there, a question did come in for Trina.
Okay.
The question is, did Baxter stay on Palladia and predict prednisone the whole time?
Good question. Yeah, so he's still on Palladia, but we've reduced his dose. So he was on, I think, either every other day or Monday, Wednesday, Friday initially, and now he's on, I believe, maybe just twice a week. So he's on a little bit less. Prednisone, he's barely on prednisone. He was basically off of it, and then he started to cough. And he started to just not like more respiratory stuff, and his radiographs were always pretty normal. And so we ended up restarting the pred. I think it's still at an every other day dose though. But I know where your question's going, and the truth is, how do we know it's not the Palladia? And that's where I think we'll have a conversation about all of this, is how do we know it's not some of our other therapies that are doing it? Because all of my cases, except my own, right, my own cat, the other two and the third one that I may discuss, they're all on something else as well. They either receive chemo or Palladia. So number one is, how do we know Palladia is not doing it either by itself, or in my gut feeling says there's a synergy between some of these targeted therapies and cannabis. So I'm going with that more because we have other dogs that have metastatic squamous cell carcinoma or salivary carcinoma that don't do even close to as good with Palladia or chemo or whatever it is. But I obviously don't have a study to prove that when I compare one to the other, you know, so anyway, okay, that's it for me for a second.
Thanks.
Okay. Well, I have two cases. Let me see if I can figure out how to advance my slides here. Oh, I'll get this figured out. So I have two cases, and both of them are fairly early on in my travels learning about how to work with cannabis. Before I get started, I will offer this up. If you do enjoy talking about cannabis cases, please join us every third Tuesday with Sarah and Connie and I. We talk about cannabis cases through the Canadian Association of Veterinary Cannabinoid Medicine group. So this first case, Cody, I picked him because this was early on, and this was way before cannabis became legal for people in Canada. And so taught me a lot about navigating this field, and basically taught me a lot about everything, I think. So Cody, born in 2004, very gregarious chocolate lab, male neutered, 40.5 kilo, diagnosed with a tumor surrounding his right TMJ, and it was definitely mucin producing. Let's see, go the right way. So in July 2014, he first presented to his vet for noisy breathing, snoring, rank breath, more than usual, and difficulty swallowing. And of course, as it always is the case, this just happened in 2 days, according to his mom. He was sedated for phenylaspirate, and the cytology came back with a high protein fluid accompanied by mixed inflammatory process, small numbers of slightly atypical spindle cells. CBC Chem urinalysis at the time was completely normal. From there, he was referred to our local specialty hospital. He did have a CT, which confirmed that there was a cystic mass around the right TMJ. Did occupy some of the nasopharynx and oropharynx, and in fact, as he was panting, you could certainly see a bulge in the back of his throat. There was extension to the level of the right tympanic bulla, and apparently some bony changes at the right mandibular condyle and the temporal fossa. Fortunately, at the time, there's no evidence of NETs on his chest, and no regional lymph node involvement. Surgical radiation chemotherapy options were discussed, but also declined because Cody's mom wanted to treat him with cannabis and nothing but. So, sorry, having some trouble with my slide projection advancing. Come on, you can do it. Okay, so I first met Kobe in July of that year when he was 10 years old, and this is very typical at the time in Vancouver, that cannabis products were on every corner and very well, very easily obtained. She was actually using a pot oil that she had obtained from a friend who had made it for a young child that was dealing with cancer. Of course, no labeling, no certificate of analysis. Suspect it did have a high amount of THC because it did tend to make him sleepy. So she came to me about, wanting to continue this. And of course, we discussed it, and I sent her to our local Compassion Club. The one in BC is actually one of the oldest medical dispensaries in the region. And we asked for high CBD, low THC formula. We also had some other recommendations about changing his diet, adding in some multivitamins, minerals, probiotics. Started him on a low essential fatty acid dosing and slowly titrated that up. And we also added some mushrooms, lactoferrin, DMG, and coenzyme Q10 as an antioxidant. So she was able to get a CBD full spectrum. And again, no certificate of analysis, but it was prepared by a licensed botanist that they had on staff. It was reported to be less than 0.3% THC in a 30 mg per ml oil-based tincture. So we started him on 1 ml actually twice a day, and that was a almost a mg per kg. And slowly over that month, titrated up. So he was getting 90 milligrams twice a day, which is a 2.2 milligram per kilo. And he was tolerating that really well. Unfortunately, the tumor had already started to grow. And at the time when he was seen by the oncologist, it was suspected that this was either myxosarcoma or maybe a synovial cell carcinoma. And Cody was given a prognosis, really bad one, of about 1 to 3 months before this would cause him severe pain and affect his life. So unfortunately, tumor did seem to be growing. And in August, we added a cultivar called Haley's Comet, which is a 20 milligram CBD, 20 milligram THC. So by the end of August, he was taking a total of 110 milligrams of CBD, 20 milligrams of THC, and doing quite well with it, no signs of intoxication. And he seemed pretty comfortable. Sorry, I always have problems getting my slides going in the right way. And so he seemed to be doing really well. Cody's mom was interested in how the mass was being affected. So he went back to the specialty hospital in December to get another CT, and it did show that the mass was getting larger and spreading. And it had, gone to reach the level of his tympanic bulla. Fortunately, no signs of metastasis, and the bony lysis seemed to be stable. At the time, since he was sedated, they went ahead and drained and took 16 mLs. That was about 3/4. They were able to drain from 3 or 4 pockets of the mass. They couldn't drain the 4th one because it sat very close to the internal carotid. So kind of look back at that first time that the referring vet drained it and took a sample. I think their aim was very good. So in March, and so again, swelling went down and he seemed to be pretty comfortable. He went back and had the mass drained again in 2015 in March and had 18 mLs. September, unfortunately, the mass did seem to be growing again, and so the CT was repeated and to confirm that it had grown and now was progressing to the retroorbital space, which absolutely was starting to cause some facial distortion. In November, because of that, we ended up adding some Phoenix tears, and by that point we had continued to titrate him up, and he was at 180 milligrams of CBD every 12 hours, which worked out to about 4.4 mg per kg. And then we started using this Phoenix tears oil preparation, where she was actually taking this and smearing it on the outside near his TMJ, and the inside where she could feel the mass. And so moving into 2016, this is kind of what Cody started to look more often than not. He went back in March of 2016 to have the mass strained again. And this time, thanks to the internist, we had started him on acetylcysteine to try and make the mucin a little bit more thinner. They were able to get 32 mLs removed. In this time too, we had added gabapentin and Medicam to help his pain management. He was also on some Tobradex and Mometamax to try and keep his eye and his ear comfortable. And he is still pretty happy and bouncy and, you know, seemed to be resting pretty comfortably. Towards the end of that year, though, that kind of changed and he started to look like this all the time. And moving into 2017, January, he went back and had 35 mLs removed, but he just didn't seem to recover as easily from the anesthetic this time. He also was beginning to have mobility issues as a 14-year-old lab. And his quality of life at that point was definitely on the decline. By March, absolutely, he was definitely suffering, and so Cody's mom finally elected to let him go. But the things I want to point out about this case that, you know, even though, you know, we don't have any guarantee about the products that he was on, that his quality of life, at least until, you know, I think January of 2017 was pretty good. And he did live 32 months past his diagnosis, which I think the oncologist was really very, very surprised about. The other interesting thing is that, you know, we do report pets on cannabis having elevated liver values, and Cody was getting lab panels pretty frequently, at least twice a year, and we would always do one before he went back to undergo anesthetic to have his mass strained. And his CBC and chem were always normal, even at the end when he was on gabapentin and Medicam. His ALP and ALT always remained absolutely normal. So he did really well, and it's interesting, his mom has turned into a very vocal advocate for cannabis use in pets. My next case is Jax, who's still going on. Jax, Siberian Husky, born in 2014, male neuter, 26 kilos. And he came to me because of his mom wanted to start a cannabis product to help with his seizures. He was the runt of the litter. He had a history of Giardia as a baby. Also, lots of recurrent GI issues, picky eater, and recurrent otitis, pyoderma. He had his first seizure in March, right before his second birthday. The lab panel at the time, absolutely normal. He had a seizure in March, and then 5 seizures in April with 2 on the same day, 3 seizures in May that were all clustered together. And so his referring vet did start him on Keppra at 500 milligrams every 8 hours, which was almost a 20 mg per kg dose. He had a seizure in June, which was about 43 days between his last one after starting the Keppra. He seemed to be doing well, but then he had 3 seizures kind of close together in the fall. And so I first saw him in October of that year. We talked about having a nutritional consult with University of Davis, which unfortunately that didn't happen until the March of the next year, but she had started working with Balance It to have a home cooked recipe. We did do some acupuncture and Tuina, which is a form of massage that she was taught to do at home to try and decrease a seizure threshold or increase the seizure threshold. We also talked about doing some supplements, the taurine, magnesium citrate, and GABA, again, to try and increase the seizure threshold. Talked about trying to reduce harm through educating her with cannabis use. And again, this was before legalization, and we had a dispensary right next door. So I could send them right from our appointment, right absolutely next door, to get a CBD full spectrum capsule that was reportedly less than 0.3% THC. Again, no certificate of analysis or guarantee on that. So we started him on 20 milligrams daily, which is about a 0.76 mg per kg dose. And then, let's see. He did have another seizure, so we increased his Keppra more close to a 30 mg per kg. He was seen again in April 2017, and at that point, he was continuing to have a seizure every 6 to 8 weeks, but it was a very mild one, and he recovered quickly. I saw him in March 2018, and seizures, last reported seizures were back in June and August of 2017. And then disaster seemed to struck. The dispensary that we had been getting his product at, by this point he was taking 20 milligrams twice daily. The dispensary closed in preparation of legalization happening. And so almost overnight, we went from having a dispensary on almost every corner to having, 2 or 3 in the city. Also, unfortunately, with his dispensary, we had problems with their CBD product being contaminated, and had a couple of cases that did come in with THC toxicity because they had gotten the wrong product. So at that point, yeah, we had no choice, but we switched him to a CBD isolate that did come with a certificate of analysis. And it was also made with hemp seed oil, pumpkin seed oil, and coconut MCT oil. We started him at 16.66 mg per ml. And he did do okay, but he did have some seizures in July and again in September. So we bumped him up to 33.3 mgs, which was about a 1.3 mg per kg dose. He did have labs at the time that, again, CBC Chem, urinalysis, and T4, completely unremarkable. And he was doing okay on that. I saw him again in February of 2019, and no seizures that had been reported, but this poor guy, had a long history of GI issues and was having more and more mucoid diarrhea, which we think was related to the oil in the cannabis product. And mom also reported that he seemed to be more anxious, which I'm not quite sure if that had something to do with the CBD isolate or because he was having diarrhea all the time. And so we talked about switching him, and in August, we did switch him to a distilled water product that was a nano tincture, which is interesting. It was at 8.3 mg per ml, but with the nano tincture, supposedly that greatly increases the bioavailability. So we started about 8.3 mgs twice a day. September 2019 marked his date of 1 year since his last seizure. December 2019, he'd had a full lab for some diarrhea again. That also completely normal. We had his annual in July of this year. Again, no seizures reported, diarrhea is under control, and again, a full lab was completely normal. And I find it with Jax that it's interesting. It's hard to know whether or not, his decreased seizures are because of us raising the Keppra, has the CBD had anything to do with it? It's interesting that when we did stop the dispensary capsule and switch to the oil-based product, He did start to have more seizures than normal. So I think that it did have some synergy there. And I think one of the things that I do want to point out is that working with cannabis, I think the potential is phenomenal for a lot of things, but in my practice, it's definitely used as an adjunct therapy that, you know, we will add it with other pain medications. And I've had patients that we've added it with chemotherapy and radiation. Definitely with the seizure patients, we have them on, you know, the normal anticonvulsives, and with our behavior cases, you know, a lot of them are on, you know, other supplements and behavioral meds too. So I think, you know, it may be difficult to tell for sure how much our cannabis is doing, but, you know, neither of these cases had any signs of it hurting them. And it's interesting, I have had one seizure case that we went through, I think, 5 different cannabis preparations, and they all seemed to make the dog have more seizures. And that dog is doing great now on just phenobarb. So yeah, very, very curious. So those are my cases. If there are any questions, I am happy to stay on, or I will mute and turn it over to Connie.
I don't see any questions coming in yet, but for anybody who's out there that does have questions, please feel free to use the Q&A feature. And as I see those come in, we'll get to those during our breaks or at the end of the session. So let's pass this off now to Dr. Mosley.
All right. So the case I'm presenting is not this one. That didn't work out. Okay, sorry. Don't press start from the play from the start. Okay, try that again. So how does it work? There we go. So we're going to start with the. There we go. So this case is kind of like the cases you guys probably see in clinics where people are just going to ask like, hey, what can I do with this dog? Like, it's just, you know, like it's not bad enough to put it on medication, but annoying enough to do something about it. So Birko, full disclosure, my dog is a 5-year-old Münsterländer, large Münsterländer, and his problem is pretty much that he's a hunting dog that doesn't go hunting. So you can only imagine, and you've seen the Springers, you've seen, you know, the typical dogs that are kind of like high working dogs and don't get enough work. So they all get a little bit wacky. He is a lovely boy, but he came right as a puppy with quite sensitive GI. He got vaccinated and ran out with full-blown diarrhea, and ever since, anytime he gets into something bad, he gets chronic diarrhea that can be bloody, that can be either food related or stress related. So he's kind of that, is he irritable bowel, is he just like stress colitis, or is he just a sensitive GI dog? He kind of like is 5 years now. He's obviously always been a very hyperactive dog, which I like about him. Like, you know, you can kind of run with him. But he's turning with his 5 years a little bit on the wacky side. So he's starting to get severe thunderstorm anxiety. He doesn't get separation, well, he does get separation anxiety, but it expresses as like he's depressed. I go to work, he just goes into his bed and he just doesn't come back out from that. So there's just something not quite balanced about him. Partially, obviously, I work too much. I don't have enough time to have such a high performance dog. So totally my fault. But on the other side, so we're trying to work with that. We'll try to kind of use the probiotics, which always seem to make such a difference, right? For any diarrhea, any irritable bowel disease dog, we know the GI and the brain goes closely together. We worked on the food to kind of trying to get away from any issues with GI. So we kind of work in a specialty clinic. So I had some help figuring it out that it's probably sensitive to chicken. Now, the problem with that is that we have chickens at home that roam. Not that he gets them and eats them, but he does eat that chicken poo, or chicken food that also causes some diarrhea. So, you know, it doesn't really quite help, but with the food, we kind of got him a little bit under control. Because of my background as traditional Chinese medicine, he's on a Shen Karma, which kind of like from a principle kind of tries to settle the mind. It's just a supplement in a way that kind of like decreases some of the anxiety. When he does get diarrhea, I usually get away with using Great Sorcerer Coptis, another traditional Chinese herb that helps to keep the diarrhea under control. Put them on rice and potato and move on to the next day. And we'll really work on some exercises. He's not just physically, he can run next to the bike or next to my rollerblades for hours. He will pant his head off, and 5 minutes later, he's pretty much ready to go again. So I do have to do games with him. So everything was kind of well under control until COVID hit, right? So that wasn't actually that I was more at home. I was more in the clinic and didn't have any time for him. And things kind of started to be a little bit out of control with him. So more stress colitis, more anxiety. And when I was trying to work with him, he's just very obsessive. Like if it comes to throwing the ball, he can do that forever, but he's so like gets that mindset. Nothing else works besides running after that ball. Or with the chickens, when they are out, he's just like, we can't even walk around the property, which is like 10 acres. He's just back at the chicken coop staring at them. So just that, like, things are like back out of whack. So we tried him because I didn't think he was bad enough to put him on any real medication per se. I just wanted him to be a little bit more happy on a CBD isolate, just to kind of see, you know, is that endocannabinoid system for him just a little bit out of whack. I didn't feel like it needed much more than that. But if you do CBD isolate, I always find it is not a quick fix. It kind of seems to be more like a, you know, like long-term commitment in a way of like, we want to build that endocannabinoid system stronger, and the CBD will help with that in a sense. It didn't really work as like, okay, there's a thunderstorm, we'll just give him some CBD and he'll get better. Not for him, at least, not at the doses we were using. But in combination with the Shen Karma on a daily dose with the CBD, he seemed to mellow out quite a bit, which was nice, without causing any sedation in that sense. He just doesn't seem to quite overreact. Like I can get his focus back a little bit easier, which was quite nice. But the improvements weren't that I was like, okay, we're really like making headways. And over time, he really doesn't like the Shen Karma, the herbal taste of it. He doesn't eat them. I have to pill him. He didn't really like that. And with the oil, it was causing some diarrhea again. So ideally, what I was trying to look for him is pretty much a hemp product, right? A full spectrum product where I have some of the terpenes in there. Didn't feel like I really needed the THC, not TCH, but the THC just because I didn't think there was anything significant behavior-wise or otherwise disease-wise that I felt like it needed that CB2 receptor or CB1 receptor really treated. But we did kind of want to have like some of that combined version of the different terpenes and cannabinoids that can be in a full spectrum component in there. So we started him on the Cove product, and that's part of it because we'll recommend those ones from the Ontario Cannabis Store website, from those legal dispensary to our clients. So I felt like, you know what, it is good to try and kind of figure out how they work on your own animals, pets, which is a 20-to-1 CBD THC product. And it also has some beta-carotene in there, which is great because it's anti-inflammatory, but also gastroprotective. So I kind of like that idea about having those terpenes in there. A little bit of myrcene helps with not sedation, but the relaxation as well. So I was hoping it was relaxing his brain. I'm not sure I got anywhere with that. The other therapies we used on him as well, we're still maintaining him on the probiotics. and really felt like, you know what, with him, mental and physical exercise is important. So I can't just treat everything with a cannabis product, but I also have to work on him on a behavior wise with keeping him mentally and physically stimulated. So more walks, more regular structure for him, and little games for him to kind of like use his brains. Especially now where like classes are not happening very much. So in result, like he really, his ability to focus more and work with me on like all these games was much better. And we could take the Shen camera off and only need it at thunderstorms days. And even those ones, he just likes to lie in front of the couch instead of in his bed, but there's no panting, nothing else in that sense happening with him anymore, which is quite nice. So maintained him on the cove for 1 month, and then we'll reduce them back to CBD isolate, which in this sense, we took the similar one that Dr. Kramer was using, a nano-encapsulated, water-soluble CBD isolate to kind of prevent the diarrhea from the MCT oil that he couldn't quite handle. So he's a happy boy again. So that is one of the cases. Where are we at with time? Sarah, do you want to do questions, or do you want me to do one more case?
Go ahead and do one more case. We've got more than 15 minutes. I think we just had one question pop up in here.
Okay.
They were just asking, how much Cove are you giving?
Good question. I stick with the, like, I kind of like started off with the 0.5 mg per kg. Didn't really like need it as much, decreased it down to 0.2 mg per kg. So not a high dose. And I kind of like, you know, yes, he is not a severe case. I think with the severe behavior issues, you would be going higher on the cases. With him just having those like, you know, annoying attitudes, the low end was more than I needed for him. And did that answer the question?
Yeah, I think so.
Good.
Perfect. So yeah, we've got a little bit more time if you wanted to do another one, and if it's a quick one, then I think Trina had one in her pocket that
is Trina still there? I don't see her on the...
I'm here. Can you guys see me?
Yeah. Do you want to do your case, or I can do this case, whichever?
Yeah, go for it, Connie. And then I think we could just talk, right?
Okay.
Just talk about why we think we're seeing what we're seeing. But yeah, go for it.
Sounds good. All right, let's do that one. So Pointer Boy, it's actually not his real name, but I'm just calling him. He's a, at the time was a 13-year-old German Short-Hair Pointer. Really, really lovely boy, rescued when he was at the age of 3. Kind of had, when he came, the old dog problems, hind end weakness and lumbar spinal pain, probably was a bit too crazy too, and running around on his property. Overall had like osteoarthritis, and that's why he came to me. He did well on rehab and all the regular kind of like treatments we do in our pain clinic. For medication, he was on an NSAID, he was on low-dose gabapentin that they took off, and they preferred to be on supplements, some of the traditional Chinese supplements, as well as you know, the green lip mussel extract seemed to control it fairly well, thanks to the rehab team and the hydrotherapy. He then developed osteosarcoma on the right front leg, and that was amputated. And you can imagine with the hind end weakness and the lumbar spine, and then missing the front leg, that's kind of like compensating for the issues in the back. He was struggling quite a bit. So that osteoarthritis was getting worse. And we always remember, like, when they have osteoarthritis in the back, both of the front legs, all our joints usually get used more and show more osteoarthritis. So we do have osteoarthritis in that shoulder, especially in the other shoulder, because that is even used more than the right one where it was amputated. After the surgery, the weight loss and the muscle atrophy was quite significant, and trying to nurse him back turned him into quite a palliative case. He stumbled and fell a couple of times, and the owner often came in just as on a short notice because of shoulder pain, neck pain from the fall, and that lumbar pain was definitely worsening. So we still maintained him quite well on rehab exercises, pulse electromagnetic field therapy, laser acupuncture, and on towards medication. He was on joint supplements, protective supplements, maintained on the green lip mussel extract. We had him on the hindquarter weakness and changed him over and added another traditional Chinese pain medication. He was on gabapentin, not too high of a dose, which caused quite a bit of ataxia. So he was kind of balanced out at that 6 mg/kg dose. And the owner started him on a hemp product that she acquired from the website. She was not a big fan of pharmaceuticals, but we did talk her, kind of almost did talk her into it, just from a quality of life and ethical point of view, to use the NSAID as needed. We know there's always issues with osteosarcomas and NSAIDs, but just from a quality of life component. And we added amantadine to it, which I really like using amantadine and NSAID together. He did not handle it very well. He really didn't like the taste of it and didn't like to eat. We had to take that one off. So you're really struggling trying to find the right products for the right dog, and he's a good example for that one. So the owner initiated hemp product, and I would say they're very lovely, kind of like gave me all the information. There was no information on the website what is in there, no quality analysis. And even when you email them and ask about a quality analysis for this particular product, you didn't even get an answer. And that's what I see in Ontario quite a bit, unfortunately. So we kind of said, you know, the owner thought, like, you know, the product wasn't quite strong enough. It was like a full spectrum, considered a full spectrum CBD based product with 250 milligrams. And when we did the math, we realized that the owner kind of underdosed him with a 0.2 mg/kg dose, which for just the CBD mainly product would be pretty low on this for this patient. The palliative stage kind of got quite advanced, and I personally didn't feel the pain was controlled for an appropriate quality analysis, quality of life for this dog. So we kind of talked about using an OCS product. We use this one. The Cove product is on and off if it's there or not, depending on how many people are acquiring it. And you know, for Trina, like in the US, it's easy to, like, you know, they have great products available. But for us, we only like legally should be talking to the owners about the products on the Ontario Cannabis Store side. So this one is pretty much a 10-to-1 CBD to THC. And the reason I'm choosing that one was that I felt like this dog really needed some THC for that pain that he was going through. And because we don't have any products that have any other information in it, if we have a CBDA in there, if we have CBG in there, if we have any beta-carotene in there, I felt like, okay, we need to have some sort of THC in there if we don't know what else is in there. So again, it's a 1 to 10 product. We started with a 0.2 mg/kg dose for this one. And even when we calculated out, we only started with using like, you know, like a half of that one. And to be honest, that was too much for him. His demeanor, and I used the low dose because I know he was quite depressed and lethargic just from everything else already going on because he was so palliative. But I wanted to have some THC in there. And he was struggling, like, so the owners were kind of like, they did not, like, so it worked well on the 0.2, sorry. But then we didn't really see much of a change. He came pretty much like 3 times a day for our rehab session, where sometimes we just did massages and acupuncture. So we increased it up because we thought like 0.4 mils or like a 0.4 mg/kg dose would be still okay considering his weight. but for the owners, he was too stoned, he was lethargic, he didn't eat. Could we have gotten through that over time? I'll ask Trina about that. Probably we could, but we reduced him back to that 0.2 mg per kg dose in that kind of setting for him and increased the frequency. We also switched the gabapentin to pregabalin because I do find the gabapentin can cause quite a bit of ataxia and sedation. So I want to keep that in mind. So if I use a CBD on top of gabapentin, is that increasing my levels? And the pregabalin has a little bit less side effects in a sense of the drunken sailor world. So he was maintained on it for 3 weeks, but he's that typical palliative case where it wasn't quite as successful as we were hoping. We maintained a little bit longer, which was just enough for the owners to actually make the decision to say it is okay to let him go, which they were really struggling with before. And then he was crossed over very humanely thanks to a mobile service in our area. There we go. That's it for me.
I think it's great. I mean, what you described in the last case is what I see a lot, right? The same thing, old dog, struggling in pain from secondary to the cancer or the treatment or age related. And you find what I would think is like the perfect product. We get to pick and choose. Like, come to America for something.
I know. No, otherwise no, but for this.
No comment beyond that. We'll have more comments in later in November. But I think like I see that all the time where I can then pick and choose. I have a product as you're describing, CBDA, a little THCA, beta caryophyllene, limonene, myrcene. I mean, it is like what you would consider the perfect package for an arthritic dog, and dose perfectly, and then the dog gets intoxicated. You're like, what do you mean? You were on the smallest amount. It's like these super older dogs, usually that have comorbidities. They just can't handle very much THC sometimes.
Right.
And so what I'll end up doing is either just, you can sometimes dilute it, right? So they can get not as much THC. The problem is you're not getting enough CBD. So
right.
Sometimes what I'll do is I'll have them start like almost like a CBD isolate on top of something like that. Or what do you do is just do what you did, which I do in some of my cases, which is get to the lowest, like the highest tolerated dose, right? Which is going to be this 0.2 that you put the pet on, and then do it. Sometimes I do it 3, 4, 5 times a day. And that sometimes does the trick for the patients that have like phantom limb pain or the severe osteosarcoma metastatic pains or histiocytic metastatic pains where it's bone mets and they're really, really uncomfortable. I will sometimes get away with that. And partly because in my heart, I just can't imagine that a CBD isolate will really do that enough without a little THC. I just think it's finding the right amount of THC for that patient is the challenge, just like it would be for any of us, you know? So I do believe you can't, sometimes you just can't force it. Like you can't force those receptors to internalize quicker. You can't force the system. And sometimes when you're just too old, is the titration just, you don't get as far as you would like to go. You just say, you know what, this is the one that you tolerate the best. It's not worth a poor quality of life for the little bit of time you have left. Let's see if we can just maintain it. If you're limited with your products, especially, I would be doing the exact same thing.
And that's the problem here in Ontario or Canada in general, that we're very limited at this point. So we just, Sarah, do your job and change that.
And I'm trying, we're working on it. We do have a couple questions that came in. If we can get to them really quickly, we've got about 5 minutes left in the session. One of them that came in here, any success stories for using CBD in a cat to treat aggressive behavior towards other cats in the house?
Partially. I've had some cats. I find, using all of these products with cats, one of the biggest problems is just trying to get it into them. Mm-hmm. But I have had a couple of cases where we've treated aggression. We've got one that we're treating for like a obsessive grooming. And we did see, again, using CBD isolate because that's kind of the safest and easiest thing that we have available to us out in BC. And did have partial improvement, but again, you know, we combined it with like Feel Away, and I think this cat was also on Zylkene and working with a behaviorist. So yeah, I would say we did, you know, did see a slight improvement, but cats are always difficult.
And it always raises a question, where is that aggression stemming from, right? Is there underlying pain or discomfort or something else? And maybe the cannabinoids can help address some of those issues aside from the actual behavioral, whether it's anxiety or depression or almost PTSD-like symptoms that we have. So,
And also,
my take would be it's worth a try.
Yeah, no, I think it's absolutely worth a try. And I think certain cats are super, super sensitive where you give them just a little bit of CBD and they do amazing, right? Like it's just incredible. And sometimes I find I don't need as much THC in cats, where in some cats, depending on what we're trying to treat, like the small cell lymphoma cats, obviously I'm trying to reduce inflammation. So I do use a little bit of THC along with my CBD, not just like a CBD isolate. But what I wanted to say to Kathy is, for your isolate that you guys have over there, have you checked it to make sure that there's no propylene glycol? Or because I know when they do have, okay, because I just worry about some of those, depending on the technologies they're using to nano or micelle or liposome, whatever they're using. That's just always something I would put out there for cats, especially dogs. It would probably have to take a reasonable dose to do that. But for a cat, they took propylene glycol out of cat foods, right, for that reason.
Right. No, the isolate that we used, I know firsthand how it's made and have seen the equipment in lab, and yeah, it's every batch is tested. So there's some really good quality control. So while you're here, I have a question myself. Speaking about, you know, terpene use in cats, that I think theoretically, you know, there are a lot of things we talk about, drug interactions, and I have had, like, the first case that introduced me to using cannabis was a cat who was on a full spectrum with a low THC amount. And this cat did amazing, which is kind of what turned me on to this whole thing. But again, theoretically, cats should be really sensitive to the terpenes, but I've not seen it in any of my cats. I'm wondering if any of you have.
No, I actually asked Kasara about that a couple sessions ago, because she was talking about some of the minor cannabinoids and terpenoids. And, you know, we were both on the same page that I think, because I see Trina nodding her head as well, in the levels that we're finding in the plant itself, I haven't seen any clinical signs, but I think as the use of terpenes and essential oils becomes more predominant, and we're starting to get people purchasing concentrated terpenes to dilute at home or use in a diffuser or add into other products, that's, I think, where we may run into some problems.
Yeah, no, I totally agree with you. I think they're just so sensitive to the smell. So it's going back to what you're saying, Kathy, is the most difficult part for a cat is getting it into the cat. The toxicity we see is so different, right? They're usually just a little bit sedated. They're not having urinary incontinence to the same extent dogs. I mean, you know, it's just so different. But when it's strong in terpenes, it's so hard to get it into the cat. It really is. So that would be the big thing. And obviously, I think we need to be sensitive with certain terpenes like limonene. Using it topically has been shown to have some toxicity in cats. So if you're going to be using a topical product that has a good percentage of limonene, you just want to be careful. Like, I always look at that stuff and just be as careful as I can. But my own cat was on alpha pinene, which potentially could be toxic, but at a fairly high dose. I think it was like maybe like 3% of the formula was alpha pinene. And he took it and was happy. So depends. Cats are funny. Sometimes they lick it off a spoon, and other times you're running around after them and you're creating more anxiety for everyone.
I know we've got a few other questions that have come in, but we've pretty much hit the time limit. So, I mean, I would certainly encourage any of the CAVCM members to come and join us in our chat rooms the third Tuesday every month, because that's what we do, is we like to just chat about cases and products and papers and issues that we're having. Anybody else have anything that they wanted to just wind up with?
If there are any questions or any comments, absolutely feel free to email me anytime. I'm at catherine.kramer@vca.com.
And then,
Also me too, anytime.
yeah, same with me. Anytime you can, mine's easy, just Dr. Trina Hazza at Gmail, or you can do my VCA account, trina.hazza@vca. Feel free. And then anyone that's in the US or interested in moving to the US, we have Veterinary Cannabis Society that we're creating, which is going to be, it's very similar to you guys, and really trying to empower veterinarians, get them educated and feel like that they're legally protected when it comes to cannabis.
With a beautiful website. It's actually really cool.
Thank you. VCS.pet. Thank you for having me.
Yeah.
Thank you all so much. I really appreciated what you shared today. As our speakers mentioned, their email addresses, you can reach out to them with the questions that you weren't able to get answered today in today's session, or you can head over to the networking tool to connect and chat with our speakers for today, Trina, Catherine, Sarah, and Connie. And also just a reminder to please take the session evaluation. This can be located under each session in the tab labeled Evaluate. And hope everyone has a good rest of their day here at the Veterinary Education Today virtual conference.
Thanks, everybody.
Awesome. Bye. Thank you.
Bye.
See you, Trina.
Bye, guys. Take care. Have a good day.
You too. Bye.